Hello, I'm Dr. Rodriguez. The coronavirus pandemic has affected us all in many ways, but perhaps none is more significant than you being unable to see your child in person. We know that you love your child, and not being able to see them has been very hard for you and for them. Now that stay-at-home orders are relaxing, DFPS is exploring ways for you to visit with your child in person again, while taking every precaution to keep you and your child healthy. One way to make sure everyone stays healthy is to ask some questions that can tell us if extra precautions are needed. That's why your caseworker will call first and ask you a few screening questions when scheduling the next visit, such as, how do you feel? Have you been sick or around anyone else who's been sick? Have you had a fever? Or, have you been exposed to someone who has tested positive for COVID-19? It's important that you answer honestly. If you've been sick or around someone with COVID-19, you will still get to visit your child. You just may need to have your visit virtually and wait a few more days to see your child in person or take other precautions. We know you're anxious to see your child, but we must all be careful so that we don't put you, your child, or anyone else at risk. When you do visit with your child in person, I ask that you do a few things to help keep you and your child healthy. First, wash your hands with soap before the visit. If you can't wash your hands, use hand sanitizer. If you don't have any, ask your caseworker. They may have some that you can use. If you have young children, use this time to wash their hands as well. Also, while it may seem awkward, we are all encouraged to keep our mouths and noses covered to prevent the spread of the coronavirus. There are exceptions, especially for children under age 2 or those with breathing problems or who can't remove the mask unassisted. But almost everyone else should wear a face mask. If you don't have one, your caseworker should be able to provide one. You can also expect things to look a bit different at the visitation rooms at DFPS offices. We're taking care to provide a clean space for your visits, and chairs and seating will be spaced out to maintain social distancing. All this to help keep you and your family safe. You should talk with your child before your visit about how different things may be. Also, be prepared for the mixed emotions that you and your child may feel when you see each other in person again. Depending on age, your child may be more emotional than usual, or in some cases even more detached. You may have some unexpected feelings as well. All of this is okay. Just be patient and try your best to talk it through with your child. This is a new experience for everyone. Lastly, if you don't feel comfortable with in-person visits, please let us know. You can always continue to have virtual visits. We understand that the risk of catching this virus can be scary and that you may have elderly parents or grandparents who you need to protect. We will respect your choice, support you in this decision, and will help your child understand you are making the choice because you are protecting them. I am incredibly sorry that you have had to experience such a long physical separation, and I know that virtual visits can never replace seeing your child in person. But I'm hopeful that with these precautions, you will soon be able to visit with your child again in person. Thank you, and if you have any questions about the visits, please don't hesitate to ask your caseworker.